pleasure to introduce the final speaker for this afternoon's session, Dr. Elio Rossi from the Lucca in the Tuscany region of Italy.
Yes, thank you, Robert. We started a few years ago to analyze atopic disease. And we and presented in India for the first time 3 years ago this study about children with atopic disease. And just to resume what was the method was just to use the GOS, Glasgow Homeopathic Hospital Outcome Score, to evaluate. And also the idea, the aim of the study was to see what is the result of the homeopathic treatment, not only in short term, but also in long-term follow-up. These were the criteria to define atopic dermatitis. These criteria for allergic rhinitis and asthma, the conventional criteria. And then this long-term evaluation, what means that we choose to recall patient not escaping from the follow-up, drop out of the follow-up from 1998 to 2006, to have at least 5 years of follow-up. We check all the patients seen with atopic disease, pediatric atopic disease. There were 165. We were able to recontact the patient 107 parents. So the criteria was, the range was at least 5 years and a maximum of 10 years. And this was in general, for a general term, we conducted this study on 857 pediatric patients with the mean age under or equal 14 years. And atopic disease patients were 325, 127 with asthma, 72 with allergy and rhinitis, and 125 with atopic disease. Follow-up was made about 50% of the patient. You see the result in general term is about 75% of patient has a GOS plus 2, 3, and 4. I mean, a good result. In some cases, about 30%, but also in atopic dermatitis, 45, 46%, complete disappearance of the disease. This was the number, the mean age of the patient and the average of the follow-up, long-term follow-up. And then you see this, the result of 107 patients with about 7 years of long-term follow-up. And we have a different percentage of successful, and you see rhinitis is less, but in dermatitis and asthma is quite high, and in any case is significant. And this is the atopic disease, not only single, but combined. And in this case, we have about more than 50% of the result, in particular of the remission of the disease. This is in contrast or better than what we find in literature, conventional literature. It's not easy to find the data about the natural prognosis and natural history of atopic disease and the result with conventional treatment. There are not many data, but in any case, you see that there is a lot of persistence. For instance, 75% of children then with severe asthma continue to have asthma as adult, except for mild and moderate asthma. There is a more possibility to be cured, to be without. This is our two publication, one on atopic dermatitis, and this is short-term term in atopic disease in general. So we start 2 years ago to analyze the adult patient, because the question was what children are very sensitive to homeopathic treatment, not only, but in general. So probably the evolution of atopic disease is easier in children, but adults are not the same. And in literature, you can find that generally when, especially if atopic disease appearance is in adult age, it's difficult to treat and difficult to cure, and the prognosis is not is quite bad or very bad in some cases. So we selected all the patients as we did with the pediatric patient. We selected all the patients with atopic disease and were on a patient. We had a casuistic of from 1908 to 2017 of 4,152 patients continually visited at our clinic. The patients with atopic disease, pediatric and adult, were 916. So we had selected adult, they were 563 patients, with 1/3 with more than 1/3 with dermatitis, rhinitis, and a little bit less with asthma. And then from these we had the follow-up patient, and we selected one number with 104 with long-term follow-up, at least 5 years of follow-up. And we were able to catch 46 of this patient, because this was the big limitation of the study, because in these last years in Italy especially, all the people has mobile. It's impossible to retake people because they don't have the fixed telephone, and it's very difficult to know where the people is located, a lot of movement. So we have, this is a preliminary study. We want to go on to reach a higher percentage of the patient. We use in these cases to evaluate the patient Riddle, which is an evolution from GOS, and the same criteria to evaluate eczema and atopic respiratory disease. The treatment is what generally we use is a Q or LM hypothesis. In acute cases, we use low doses, low potency like 6 to 30, and we follow the period, the initial period with Q potency with centesimal potency. So I mean, this is a system to avoid an important aggravation at first. So we use all the series, also the decimal if needed, but in sequences, not together. In case of atopic dermatitis, generally we use a basic moisturizing cream without any kind of treatment, or sometimes calendula where there is some scratch or something like that. This is a statistical analysis we performed with the specific test. And this is the group of the patient. You see now 916 and 563, 60% were adult. The mean age was 38, and mainly female, but not so much. And this is the table in which you see the number of adults, and atopic dermatitis. Most of them use a conventional treatment before arrive to homeopathic treatment. And this is the general number that you have seen before also. You see it's about the same, it's a little bit less. We have a good result, Oridil plus 2, 3, 4 in about 70% of the patient. And you see the resolution also in a good percentage of cases, but less in atopic dermatitis, but here in allergic disease and asthma, allergic rhinitis and asthma more. This is a long term, In this number 45, we were able to take contact with about half the number of the adult patient lost at follow-up, 50%, 51%, but only 46 were able to give good information. Other people doesn't remember, they don't start the therapy, so they were not possible to include. And 90% were male, female, 27, and the result, the main period of follow-up long-term is 8.2 years. And this is the result. We divided, we found the patients who are completely cured or with a good remission of the under treatment, still under treatment after many years, or without any kind of treatment after the homeopathic treatment. And you see in this case the numbers are small, but you see 75% of remission in patients with asthma, 60% of remission in patients with allergic rhinitis, and seems, well, the number is very small, 100% of the treatment of the patient with dermatitis. In general, about, again, 70% of the result, in which is important to see the disease, we speak about remission. The other possibility, the other interesting things that also severe cases were reduced to mild and moderate. In literature, you can see that severe cases remain severe in general during the adult age. This is the group of complex atopic disease, and you see that we have a good result, 50% of remission in patients with asthma and rhinitis, which are not very simple patients. About the same in children, 56 in children, 54 in adult of complete remission. Another thing, the last thing, is to compare adult patient with pediatric patient. And you see, if we speak about remission, we have a number higher than adult in children, in all the three atopic disease, but the percentage of a good result, important result, is major in adult. You can see better in these. You see, this is asthma, and this yellow or orange is children. And you see, in this case, there is the important result similar to remission. In adult, it's much more the third level. This is in allergic rhinitis, in which you see, quite surprisingly, you have a remission of allergic, disappear allergic rhinitis, partly with under the therapy, partly without homeopathic therapy. I mean, after homeopathic therapy, there is a remission every year less, until there is a complete remission. And the last is atopic dermatitis, and you see this is natural course of the disease that facilitate from a good result to complete remission in a high percentage of cases. So this is the difference. So as I told before, there is no control group, but this is a retrospective study, outcome study. Maybe the result can be influenced by the natural course of the atopic disease. Of course, we need a randomized control studies to confirm this good result. Well, all the treatment was paid by Tuscany region. And this is conventional treatment result. You see, there is 70% of the patient reported atopic dermatitis in adult age, and the severe atopic dermatitis in 12%. In adult asthma, remission rates are low and limited to milder cases, and is not so in our patients. And you see also the satisfaction of atopic patient is very unsatisfactory for an important percentage of case, about 35% of case. So the conclusion is that finally adult patients seem to show a tendency toward a more significant reduction in severity of all atopic disease, even a complete remission at the long-term follow-up compared with the resulting conventional treatment according to the data of literature. My just last comment that if you are not working with suppressive treatment, cortisone, antihistaminic, etc., you can see the development of the atopic disease, especially in dermatitis, especially in asthma, and then a remission that you control and manage very well, or mostly very well, with a homeopathic remedy, and then after a while, few years, the disease tend to disappear. This is my conclusion of this item. Thanks you for your attention.